Okay, so we're here today at the American Academy of Procedural Medicine, and we're going to talk a little bit about technique for injecting dermal fillers. So we're going to go over a lot of different things, but there's a couple little tricks that I want to show you. Remember I started telling you yesterday about how to hold the syringe and how to kind of hold it and how to position and so forth, and by default it'll almost kind of force you automatically to have the correct angle. Because one of the biggest mistakes I see that people do when injecting is they don't have the correct angle. And if you don't have the correct angle, and if you're too deep, you're not going to get an effect, all right, which is just you're wasting your product. It's not going to cosmetically do anything bad, it just is not going to have an effect. If you're too superficial, it's cosmetically, you're going to see bumpiness and unevenness and it doesn't look good. So you want to get the correct depth. So this is kind of just a little trick, all right, on showing you how to get the correct depth. Okay, so the first thing, we've already completed the consultation, we've already done our history and physical, now we're going right to the procedure. So first thing, close your eyes please, is apply some alcohol. I'll tell you when to open it because I don't want your eyes to burn at all. Okay, keep them closed. Again, what I was telling you from the other day is you're talking to the person like this, all right, and I like to kind of come back over here so they never really see the syringe or the needle. And you're talking to them like this, you're right in front of where you want to go. Now, what I see people do a lot is, think about it, if you hold a syringe and a needle like this, and turn your head just a little bit this way, if you hold it like this, by default, you're too deep. All right, so if you're going to go in like this, you're too deep. If you wanted to hold like this, which you can if you want, but in order to get the correct depth, you would have to bend your hand all the way down like this. That's because that's the correct depth right there. So don't hold it like this. All right, the second way I see people commonly hold a syringe is like this. Okay, I see nurses do that because they're trying to get that pediatric vein and they're trying to do that, and it's very, very superficial. So if you do it like this, yes, you could definitely get the correct angle, okay, but you almost have a tendency of going too superficial. All right, so if you hold it the traditional way, okay, just like this, if you hold it like this, almost by default, you're going to naturally get the correct depth. Just you put your hand here, you're almost at the correct depth. All right, so turn your head a little bit towards me. The next thing as far as technique, okay, and it's the same concept with Botox we were talking about yesterday, is you go in like this, your hands are shaking, so you want to anchor your hand. You want to anchor your fingers so that you're very, very stable. So what I usually do is I'll put this thumb over here to bring the skin down and make it a little bit taut, and then these fingers that are dangling over here, I'm going to rest my other hand on it. Now I am so stable right now. So if you can you kind of come in a little closer and you guys see that? This is so stable, I could do this injection exactly where I want to do it. So now just a little pinch right there. There we go, a little pinch. This has lidocaine in here, by the way. And then you just advance the plunger and the medicine forward. And this is pretty neat because you're going to see a result like immediately. Pull out. Now look at that. Can you see the effect right from there? All right, now what I usually like to do at this point is I stop for a couple minutes, let the lidocaine work, and then I go to the other side. All right, talk a little bit, and then do the same thing on this side while the lidocaine is working on that side. Okay, so relax your face again. Wait, don't smile. I think maybe she smiles too much. That's part of the problem. Okay, so now you have this finger here. You're just kind of bringing it down like that. And then you've got your other hand here, and you're just resting it. And where you're injecting is just medial to the fold. So right there. There we go.
How much are you putting in?
Well, okay, I'm going to answer that. Let me just take this out. And that's it. Oh, thank you very much. Okay, so that's the main point I just wanted to make here was how to hold a syringe, hold it the traditional way, okay, and that's going to give you the correct depth. Try to avoid holding it like a pencil or in this other way like you're doing it superficial.